In today's video, we're going to be talking about what are herniated disc symptoms. Now, in order to understand what herniated disc symptoms are, we need to understand a little bit about the disc, and then I'm going to explain exactly what a herniation is. So when we look at the disc itself here, so the disc is comprised of the nucleus, which is the center. It's about the consistency of toothpaste. And the outer rim of the disc which is made out of cartilage. It's called the annulus. And we want to make sure that the thickness of the disc, see how thick this disc is here? Well, when we're born, the disc is more like that. And so what can happen is the thickness of the disc can begin to shrink down. But with a herniated disc, the disc itself begins to get injured. And so when we look at this more advanced condition here as far as the disc goes, we can see how the center of the disc is actually starting to push out against the side here. And what happens with a herniation is that the disc begins to tear from the inside out. So as it begins to tear, the center of the disc will push out against the outer portion of the wall of the disc. And if there's a nerve that's running by there, that protruding disc or that portion of that disc that's pushing out there is going to put pressure against your nerves. And so as we're looking at this model here, we can see how the nerve exits the spine. And if there's pressure on the disc itself, sometimes it will occupy the space within here. So that's a little bit about the anatomy of the disc there. But what happens is that the disc begins to protrude, and as that disc begins to protrude, if there's a nerve there, it's going to put pressure against that nerve. And what we want to do is we want to begin to take pressure off of the nerve, but any time that there's pressure on the nerve, there are several things that can happen. Okay, a nerve can get stretched, it can get twisted, and it can get compressed. And so nerves can get affected in different ways, and when they get affected or they become irritated, you could have pain, you could have numbness, you could have tingling, you could have weakness. You know, sometimes what happens is people notice that they can't open a door or a jar as easy as they could before because they have a pressure on their disc. They can have a herniated disc in their neck, and it causes weakness in that part of their body. And so if you're experiencing any of these symptoms, either in your arms or in your legs, it could be an indication of a herniated disc. And so the way that we look at a herniated disc is on MRI. MRI is the best way to be able to visualize a herniated disc. And as we understand what's going on specifically with the disc, so that MRI will pick up whether or not there is protrusion, like here, where the disc is sticking out of the spine and it's putting pressure on that nerve that's exiting the spine. And so when you understand exactly what condition you have, it becomes much, much easier to treat it once you know. This is a little tutorial on herniated disc, and I believe that the more that we can understand about our body and the condition of our body and what type of problems can occur, we can start to avoid them so that we don't have problems in the future, and we can age better, live better, and enjoy life as much as possible. The next video is going to be on the top 3 ways to avoid back pain during pregnancy.